What is ALS? Amyotrophic lateral sclerosis is a deadly disease. Lou Gehrig was a famous baseball player who died from the disease. People of any race or ethnic group can be affected by the disease, although it can occur at a younger age. There is no cure for this disease. There are two main types of the disease. This is the most common form of the disease in the U.S., making up 90 to 95% of all cases. This form of disease affects a small amount of people. It is a devastating disease that affects the function of nerves and muscles. It is not possible to transmit the disease of amyotrophic lateral sclerosis or Lou Gehrig's disease, and it does not affect mental functioning or the senses. It is characterized by the loss of nerve cells in the brain. There is no known cure for the disease, but there is a treatment option for those with symptoms. Who gets ALS? Every year, around 1 to 2 people are diagnosed with the disease. White people and non-Hispanic Americans are more likely to get the disease. Researchers aren't sure why men are at higher risk of developing the disease. Military veterans may be at higher risk. They may have been exposed to lead, pesticides, and other toxins during their service. Symptoms are most likely to develop between 55 and 75. The risk is the same as getting older. How is ALS diagnosed? How is it diagnosed? Your healthcare provider will ask you about your medical history during the physical exam. You will need to have several tests to confirm the diagnosis. The electrical activity of your muscles and nerves is measured with an electromyogram. Magnetic resonance imaging can be used to look at your brain and spine. Other tests can help rule out diseases that may cause the same symptoms as ALS. A test for brain and spine problems uses substances in your spine fluid. A tissue sample from your brain or nerves is taken for examination. Symptom: muscular weakness or atrophy is the earliest symptom of the disease. Other symptoms include trouble breathing or swallowing, dizziness, and muscle weakness in the arm or leg. Motor neurons in the body are first damaged when symptoms of amyotrophic lateral sclerosis or ALS start. The first signs of limb onset are in the arms or legs. If the legs are affected first, people may experience awkwardness, tripping, or stumbling, and this is marked by walking with a dropped foot that drags gently on the ground. If the arms are affected first, then they may experience difficulty with tasks that require manual dexterity, such as buttoning a shirt, writing, or turning a key in a lock. People experience difficulty with swallowing, speaking, or forming words. Intercostal muscles that support breathing are affected first in respiratory onset ALS. People experience difficulty in swallowing and talking over time. Most people with the disease have a symptom of pain, which is caused by reduced mobility. There are a number of symptoms of lower neuronal disease that can be seen under the skin. The symptoms of the disease can be different for everyone. Will I need breathing support? You may find it hard to breathe as the disease progresses. You may benefit from the use of a non-invasive ventilation. You get 4 by wearing a mask over your nose and mouth. You may need mechanical ventilation in the future. It helps inflate and deflate your lungs. When it's time to make a decision, you will discuss this option with your care team and loved ones. What exercises can help people with ALS? Getting active can help with weight loss and well-being. Aerobic exercise increases your heart rate and breathing rate. They help your muscles work harder. Stretching can help reduce muscle pain. They should be done every day to prevent pain. Avoid strengthening exercises, such as exercising with weights. They won't strengthen your muscles, and they could make them weak. Exercise in moderation. If you get tired, your muscles may weaken. Can ALS be prevented? There is no proven way to prevent the disease. You can take part in clinical trials if you have the disease. Doing so can help understand the disease. Researchers can learn more about causes and risk factors as they gain more knowledge. This information may lead to better treatments. End-of-life care. After someone is diagnosed with a disease, it is a good idea to start palliative care. People with the disease can have time to consider their preferences for end-of-life care and avoid unnecessary procedures. Difficulty speaking due to muscle weakness and cognitive impairment may impair their ability to communicate their wishes. If the person with the disease is not solicited for their preferences, there may be an unwanted emergency intervention. If people with the disease are reluctant To discuss end-of-life issues, it may be useful to use the introduction of a procedure called a gastrostom. It is not clear when the end-of-life stage begins in the disease, but it is associated with difficulties in moving, communicating, and thinking. Hospice care is important in the management of symptoms and the likelihood of a peaceful death in the disease. It is important to provide care at the end of the life. Opioids and benzodiazepines can be used in the final days of life to treat anxiety and pain. Late-stage disease management. Difficulties with swallowing and chewing make eating difficult and can lead to a risk of food getting into the lungs. Individuals affected by the disorder may lose the ability to initiate and control voluntary movement. Bladder and bowel function is usually spared, meaning urinary and fecal incontinence is uncommon, although trouble getting to the toilet can lead to difficulties. The extraocular muscles that move the eye are usually spared, meaning that the use of eye tracking technology to support augmentation of communication is often feasible, albeit slow, and needs may change over time. Many people with advanced disease report satisfactory well-being and quality of life. This can happen before limb weakness is apparent. Maintaining a healthy weight can become a problem in later stages of apprehension, and the need for a feeding tube can be a significant problem. What are communication tips for people with ALS? If your friend or loved one is having trouble speaking, you can ask questions that require a yes or no answer. They can be asked to repeat what they said, speak slower, or spell out words that they don't understand. Talk to them in person. Look at them. You should repeat part of the sentence. They need to repeat things they know. Thank you for watching. Do subscribe, like, and share.